Hi, and welcome back to Building Pathways to Healthy Minds. I'm Priscilla Bagley, and today I sit down with Stephanie Smith, who is a nurse working with patients with mental illness. We are going to chat more about child abuse and its correlation to mental illness later in life. But let me tell you more about Stephanie. Stephanie has been a registered nurse since 2013, started working with a mother-baby unit, and then realized in a change she did not see herself making that she needed to work as the director of nursing for an inpatient psychiatric hospital. Once she was there and observed there was a severe shortage, she realized that this group of people needed a community that was well trained. And so she expanded her education during the pandemic, and now she works in the community as a board certified psychiatric mental health nurse practitioner. She's an amazing person, and she has a lot of insight into abuse, what happens with that, and its correlation to more disorders and issues later in life. And this is at the very heart of what ChildBuilders is seeking to prevent. We want to get in the community. We want to tell children, empower them, empower educators and parents to have healthier communities. So I hope you enjoy this show. Grab some coffee, get on the road, enjoy my conversation with Stephanie. I am so excited today to have a good friend, Stephanie Smith, on. Welcome.
Thanks, Priscilla. Thanks for having me today.
I'm so excited to get to do this. Tell us a little bit about maybe your title and what that looks like and what you do on a daily basis.
So, I currently am a board certified psychiatric mental health nurse practitioner. I see patients in a clinic setting, and what I do is give psychiatric evaluations to patients that come in. Sometimes they have already been seen by somebody, and they might just be reestablishing care now that they've moved to the area. Or I also see patients virtually all over the state of Texas, and they come to me sometimes not knowing what it is, sometimes having an idea. So basically, I will provide that evaluation and then work with the patient to find some appropriate treatments, combination of treatments. So sometimes that involves medications that help that patient address some of their issues that they're having, but also allow them to do other therapy modalities so they can really work on those areas where they're struggling the most. And then we meet back, depending on the patient, every so many weeks and hopefully see some progress with whatever their current struggles are.
That's amazing. Would you share a little bit about your background and more about you and who you are and how this kind of happened in your life?
Yeah, absolutely. I grew up in San Diego. Very thankful to grow up to two loving parents. I'm the second of four children, and in high school saw my parents struggling as they separated. We later found out while I was in high school that my mom was bipolar. She struggled with severe depression, postpartum depression, and my father is a Vietnam veteran, and I'm so proud of him. But we know, looking back, we didn't talk about PTSD. And my dad, bless him, was drafted after he graduated high school and spent 18 months with the Army and then was just plopped back into life to get on with life. And that's what he did. So both of them struggled in very different ways with mental health. And I think that really allowed me to grow up just caring about other people and their struggles. And now, as an adult, after thinking I would never be a psychiatric nurse, I just really found how much I loved it, how much I love people. My life allowed me to enjoy sitting with hurting people.
I think the first time that I really was like, I want to interview you on the podcast was we were in small group at church and we were talking about why do we see so much mental illness or why is this a thing that happens often? And you responded, often there's some kind of trauma or child abuse in the background of somebody who's struggling. And I latched onto that because of ChildBuilders, knowing, we do this work where we see the stats and we know that this is a huge issue and it's prevalent and it's all different kinds of families. There's not one family that's in the category of this having abuse, right? You can be wealthy, you can be struggling to survive. I mean, there's all these different things. And so when you said that, I was like, we need to have you on and we just need to talk about what that actually meant when you said that.
The longer I'm alive and the more people I meet, even before being a nurse practitioner, I started to realize that there is so much more abuse. I believe the statistics are much higher than what is actually reported. Even now with the patients that I see, how many people had abuse as a child, physical, emotional, sexual abuse that was never told or disclosed to anyone their entire life. So these are just things that they carried all by themselves throughout their whole life, and how heavy, what a burden to carry that without telling anyone your entire life. It really is an epidemic.
And we know through the ACEs study, the Adverse Childhood Experiences study, that mental health is closely tied in, that if somebody has experienced an adverse childhood experience, that there's a higher prevalence for mental health issues later in life.
Absolutely.
So do you see that often when you are listening to people and talking to them about what's going on?
Yes. I absolutely see, as I'm doing an evaluation, different points in a person's life. Like, oh, that was there. There was physical abuse. Maybe they were neglected. They didn't have people there supporting them. And now seeing what's going on in their life as an adult, like there absolutely is correlation with that.
Yeah. Yeah. So let's dive into that subject a little bit. So, what patterns do you commonly see in adults who have experienced abuse as children?
So this one is super, super interesting. A lot of adults can be seen as chronic people pleasers.
Mm.
There is a need to make others happy, or even, I need them to like me. And many times it comes at their own emotional expense. So we see this a lot when people had to navigate very unpredictable households. So maybe there were parents that were very volatile, they were on eggshells all the time, and they were constantly assessing their surroundings. And they were constantly adjusting themselves as a child, making themselves smaller, changing their, okay, well, I need to be extra caring or extra this today. So that is definitely makes its way into adulthood, kind of leading into something else. A lot of times, those people also have trouble setting boundaries.
Mm.
It becomes very, very difficult when that person is faced with a potential boundary that they want to set or thinking of setting. It can really flare up all these feelings inside of fear, guilt, and tremendous anxiety.
Yeah, that totally makes sense. It's when the people that you're supposed to be trusting and attached to have led you to kind of feel like you're not enough, or the things you do aren't good, or then you're constantly trying to have to do that in the years that you're supposed to be the most surrounded and protected. That leads to lasting effects into adulthood when you're trying to figure these things out on your own.
Well, and even ultra independence, we applaud people that are independent. Yeah, you're such a boss. But ultra independence and unwillingness to ask for help or depend on others is something we see in many adults, that it can be a sign that when they were a child, their caregivers, their parents were untrustworthy some way or were unavailable. That can even cause issues in relationships, marriages with building intimacy, where you might really, really want to, but you have built these walls of independence around you.
And you don't even know. That's been your normal, right? When that's a broken relationship is a normal to you.
Yes.
It's hard to form healthy relationships.
And even as we get older, you use the word normal. A lot of times as you grow up, what is around you in your household, that is normal. The way your parents interact with each other, the words that are used, the behaviors, that is all normal. And sometimes as you get older and hear from other people, oh, wait, your house was different?
Right.
I didn't know it could be
Had
different.
no idea.
You
Yeah.
slowly start to put pieces together, and then sometimes it can hit an adult out of nowhere. Like, maybe what I grew up in wasn't normal. And they can start to put words to some of the things that were around them.
So do you think these traumatic things, you said that they definitely impact relationships as people are getting older and getting married and those kinds of things. How does that have you seen that at all impact parenting? for those individuals?
Oh gosh, parenting, absolutely. Parenting is so hard and it is an adventure. We all start off knowing absolutely nothing. I have an 11-year-old son and I have a 9-year-old daughter. And so I am humbled frequently by both of them. Anyone that grows up with trauma or abuse around them, it can make it much harder to become emotionally regulated or really learn how to emotionally regulate. It can be easy to become very reactive to something a child does, where they're a child. They're not supposed to know how to be emotionally regulated. It's a 3-year-old. We know that they throw tantrums. Like they're slowly learning, some independence versus totally relying on you for everything. And it is so easy to yell, get very upset, have bouts of anger well up because that emotional regulation is so difficult, or maybe you are mimicking something that you saw. And as a parent, most of us need probably some more sleep, some extra naps,
Right.
some self care. So when you are not at 100%, it even makes it that much harder to be grounded, calm, and approach the situation, as a logical, loving parent.
That's so smart. Um, I think parenting is so hard even when you've had really good examples of parents, I mean, it really tests you. Obviously, it's not the end of the story, right? I mean, you can have traumatic childhood and transform the way you parent. How would you speak into that? What is some things that we can do to just get better, even when we're dealing with our own past traumas?
I really believe that our culture has become so isolating for many people. Years ago, a lot of families, you all lived around each other, you had more familial support, even different generations helping out other generations. And it is more common now for people to be spread out and not have as much family help. Things are more expensive. So we have more parents working outside of the home, financial stressors. So I really think it is so important for us to find a group and plug ourselves into it. Find some sort of community. Even I know here locally, there's a group called Stroller Striders that meets at a park to go walk and have infants. Like sometimes even having someone that you can vent or complain to, that understand they're in the same part of life that you are. Sometimes we can learn simple tips and tricks like, oh, that's a really good idea. I didn't think about that. Or seeing someone else's struggles, you don't feel so alone. I feel that community is so important. That isolation just is so brutal for our mental health.
That's so true, and I feel like that's a common thread lately on almost all the podcasts, no matter who my guest has been, when we say, "What makes this better? What makes this parenting journey better, this relationship journey?" It's almost always find your people who can listen and who can say, "You're not alone. I'm there with you." So important in parenting because you can hide and say, "I have it all together," and never show anything. And we all know none of us are there. But it's so much more vulnerable and so much better when we step out and say, "I'm having a rough day. Can you come alongside me today?"
And also having friends just whom you can say I'm having a rough day because we're human. We're not perfect beings. We are going to have rough days. Just having those people around you, like, yes, I've got you. Let me bring dinner over. One of my best friends will always say, let's go get chips and queso. We're going to have chips and queso where we're just going to talk it out and get those feelings out. Working in a field where a lot of my patients have thoughts of self-harm, of hurting themselves in some way, the best thing that they can do going to therapy, having someone to talk to, having people around them and a support, that is so important. Having in their care plan, like finding supports for them.
And I think so often when we're dealing with mental health issues, we kind of want to hide. I mean, especially when it's been stigmatized in the past. Those are the times even more so you want to go into yourself when really the most healing thing is walking this with somebody else.
Yes. What you just said in mental health, I see like women tend to more internalize their struggles and their distress that we see kind of manifest as their anxiety, their depression, maybe some numbness. However, women are more likely to seek social support. That is a positive for women that they will seek out more groups. I do see overall in male patients, like they're more likely to have more externalized trauma. They're not going to seek as much support. And even some of it is culture. I have to be a man, I have to provide, or they feel these pressures put on them, and also not to be so emotional and let everybody see that. So we see more things like aggression. We see more likelihood of substance use and abuse, and even risk taking behavior, rage and anger kind of even couple with impulsive behavior. So bringing our culture to a place where it's also okay for men to want to seek social support.
Yes. Yes, absolutely. Do you see same kind of prevalence in men and women who come to get help?
I have some patients who more recently, in the past few years, have become okay with seeking support. I do see improvements in that stigma that, held for so many years. It is starting to change. Therapy for many people, that is, why do I want to sit and just talk about my problems with somebody? That is slowly changing as others around us in the community, other men, other people in the spotlight actually say, you know what, I struggled, and a therapist, a counselor, group therapy, whatever it is, was helpful. And so one by one, I do see that change starting to happen.
I think so too, and I think the more we tell each other, "Hey, I've been where you are and this helped me." I've done therapy off and on since college, and I've always left with it felt like a lighter load. Like, sometimes things didn't get just figured out. Nothing ever gets, like, magically figured out, but what you do hear is that you're okay, it's gonna be okay, and we can keep talking through this till it's better, till it's different.
Yes. I tell my patients, I say, if our mind is a pot of boiling water, like that steam has to go somewhere. It can't just sit in there or it's too much pressure. It has to find its outlet.
Yeah. So switching gears a little bit, in Child Builders, we have this curriculum. We're really big about prevention because we know if you can prevent child abuse and trauma, that a child's going to be more likely to be healthy and have healthy relationships and all those things. So we have these 5 steps. I want you to tell me if you just if there'd be anything you'd add or if you agree. So we teach kids, number 1, know if it's safe. So we go in and we teach different scenarios about abuse and about kind words and all those things, and we talk about how unkind words are not safe either. So is it safe? Be assertive. So assertiveness, key trait for children to be able to say, no, I don't like that. Or like you mentioned earlier, that's crossing my boundaries. That's not okay for you to do. To get help. So tell an adult, keep telling until you get the help you need, because sometimes that first adult isn't going to help. So continue to tell a trusted adult. And then 5, it's not your fault. Just curious, what are your thoughts you've got the other spectrum of seeing patients who lived through abuse. How do you feel about kind of those 5 core concepts?
I think those are fantastic. So many children feel that they have no voice, that their voice is too small. Just teaching them, no, you do have a voice and it can be powerful. There are so many people around you that want to make sure you are safe. Telling your teacher, if you're at a pediatrician's office and you need to tell the doctor, I'm so happy that there are more and more child trafficking posters and signs. If you need to text, you can text this number, just for kids who are going through abuse.
Yeah, because I think so often, like you said too at the beginning, you may be conditioned to be a people pleaser because you think that's what people want from you. So you're not assertive, you're passive. We also want kids to know we want to get help for you, but we also want to get help for the person who's doing the hurting. Letting them know, being assertive, talking about boundaries, telling when something that isn't right. That whole thing we were just talking about, which is like coming out of hiding and getting help for everybody involved. Because it may be a parent who just is having a rough time and needs to get some help.
With the use of social media, lots of cell phones, internet access, so many places, even children knowing that if any type of indecent exposure, any picture that pops up, even if it is brief, should be reported. Just with the amount of trafficking and very subtle grooming, just, little tiny things, 1 second at a time. I feel that children should know that. Like you said, it's not your fault. But if a picture of a naked body pops up somewhere, whether it's on a TV or on a phone, like you need to let somebody know that.
Absolutely. Do you think talking to our kids about those things as parents is useful? And do you have any tips for doing some of that?
I feel that you know your children the best. So some kids get more mature a little quicker than others, but definitely talking about, yes, you have your parts, this is what you were born with. And making sure that they know that these are yours, no one should be touching them. And as they get older, making sure they are aware that that content is not supposed to be anywhere that they are.
Yeah, I think there's a fine line sometimes between, and I've actually talked about on another podcast about this, is like we don't want to scare our children, but we do need them to know we live in a world that is broken and there's some unsafe things, and it's never okay for someone to cross your boundaries. You can be assertive. Never okay for somebody to touch the private parts of your body. Yeah, so having those conversations even early on, I found as a parent, were there were ways that I could say it. I didn't want to just say the world's a scary place, right? But I did want to say, if this ever happens, you can tell someone, you can get help.
And children knowing that no matter who it is, they can still tell somebody about that person. I have had patients whose families were very protective, just over family members in general, and where the victim as a child never felt safe disclosing it to anybody.
Yeah. How do you support patients who are just beginning to recognize past trauma?
Ooh, this one, this one's so hard. There are times I will tear up and we're just going to get some tissues and just take some deep breaths. I'm never going to force a patient to talk about something they're not comfortable going into. There are times, we can package up some of our distant memories and they are folded up in a box in the back of our mental closet. And you can be going along your life and out of nowhere, something can just pop back up and you start having very different feelings. Maybe you have anxiety, maybe your mood is low. A patient can feel like they're not themselves. I'm never going to suggest things to them because I never want to put an idea in someone's head, but just very gently let them speak, to let them tell their story. And I always encourage them, along with myself, to find a counselor who has even longer sessions where they can go even deeper on some of those topics.
No, that's so good. To listen, come alongside, and then say, hey, there's extra help out there that we can go deeper with this.
Yes. And acknowledging that those thoughts and feelings can be very scary. It can be overwhelming. And just apologizing and saying, I'm sorry that happened to you, because you are a human with dignity and respect. And that should have never happened. And it is really amazing sometimes, even somebody hearing those words.
Who maybe have never heard that before.
Yes.
What has this work taught you about resilience?
No person is too far gone. And after trauma, many patients, as they get older, kids grow into adults, the way that we speak to ourselves, we would never speak to another human being. Learning really like, oh, I shouldn't be speaking that way. A lot of times we end up mimicking a loved one who spoke that way to us, repeating things that we've heard, no matter what happened to a person. Because there are all kinds of different traumas, whether it was from your family or from a war. What our mind and body is capable of is amazing. So whatever is happening now, when you are in a dark place, it's easy to think that this is all that is ever going to be. And that is a lie. Things can get better. It does take work, but no one is too far gone.
Yeah. And like we said at the beginning, most of the time you find someone who says, I've been there too. It's not just you. You feel so alone. You must be the only one who's had this thought, the only one who's experienced this, or something's wrong with me if I'm experiencing this. I love that you touched on this just with that answer, because I think another common thread lately in the podcast has been giving ourselves a lot of grace. Do you have some just practical advice on self-talk, how we talk to ourselves, how we can change our inner monologue?
Something that I have implemented for myself that I have found very useful is to verbally stop myself in the middle of a thought. It is so easy to criticize the way you look on the outside or be comparing ourselves to other people. And I know social media has just caused so much more of that. To stop myself and actually call myself out. So I will say, Stephanie, stop. And whatever the thought was, like, you can do that. Like, yes, I might be feeling tired today. I might not be feeling my best, but I am capable or I am beautiful. And it really is surrounding yourself and finding ways of putting positive input back into your life. If somebody was exposed to a lot of negativity, that does add up and add up and add up. So we have to start reversing that.
And I think you're able to. I mean, I think a lot of who we are is what we think about ourselves. We can change how we even see ourselves by recognizing what our thoughts are. I know somebody once kind of gave me the advice to journal. Just journal how many thoughts you have about yourself and how many are negative, and start really reflecting on what you're saying about yourself throughout the day.
People with abusive pasts can have a difficult time even accepting a compliment. It can be very hard, it's just brushed off. Oh, it's not true. Along with that hyper independence, some of the trauma is even perfectionism or being a high performer. Abuse does not discriminate. It really, truly is every single type of person you can imagine. When we compare ourselves to other people, like, you have no idea what that person is struggling with inside. We really have to just stop. I am beautiful. Or what do you like about yourself? I really like my hair today. Like, my hair looks nice. And yeah, there might be things that you want to work on. And if that's true, okay, so because I don't feel so great today, I'm going to make an effort to go outside for a walk and do something positive.
And it takes a lot to be able to do that sometimes. This is maybe a totally crazy question. Why do you think abuse is so prevalent, and why are so many of us walking around with that in our background?
I truly think that the definition of abuse over the years, we have really broadened it. So when I was a child in the 80s, abuse was only physical abuse or sexual abuse was considered abuse. Studies are even focusing on how emotional abuse, verbal abuse, even things that are said to you, even if that parent or caregiver never spanked you, it can still be just as detrimental to someone's mind. Even though there was no physical touch, no sexual abuse still causes higher rates of mental health issues, anxiety, depression, suicidal thoughts, higher rates of bipolar. Even though it's not a causative factor, we know that it definitely contributes to mental health diagnoses.
And I think so much of that too is what we were just saying, is that sometimes the thoughts that other people give us about ourselves, the things we hear, almost can change the makeup of who we are. It may not even be true, but we've heard it over and over until we believe it enough, and it does almost become true.
Yes. And it doesn't have to be true. But if you do think it enough, if you take eating disorders as an example, you can have people that are wasting away, but they see that there's a problem with their body and they continue to restrict food. It really becomes what they're focusing on becomes their reality.
One of the things that even if we're not dealing with a severe, mental illness or things like that, just on a daily basis, being mindful of our thoughts and changing our inner dialogue to the truth of who we are can actually change our days, change our lives.
And I am a big proponent of even just small everyday habits that we can use to really boost our self-esteem, boost our mood. I know dysregulated sleep can be such an issue for so many people, but trying to get to bed at a similar time at night allows your body, when it releases the melatonin inside, you have a much better chance of falling asleep faster, as well as when you get up in the morning, if you actually step outside, the light photons, when it goes into your eyes, it actually helps set your circadian rhythm. It's morning, there's light, I need to go to bed at nighttime. So it reinforces that pattern of better sleep. Exercise, any form of exercise releases positive endorphins. I do prescribe medications, but exercise is shown in so many conditions to work even better than medication. So doing something for your body. So sleep, good sleep, getting some rest, getting outside, hopefully at least a little bit, eating a more balanced meal, because when we eat more sugar in our body, we can have more spikes and that can even make us moodier. So taking care of ourselves is so important. And it can be so hard to do when we're so busy. And it seems so silly sometimes to say out loud, like, okay, eat better, get to sleep on time. And it can be so hard. So even just one small habit a day, like I'm going to try to drink more water today, or give yourself 5 minutes outside. The best things typically are not instant. And we are very much an instantized culture where we have our TV shows on demand. We have the fastest food we've ever had, but that's not in the long run going to serve us well.
So good. All right. So I always ask everybody, if you could leave something with the listeners today, one thing from our conversation, what would you want to say to them?
I want anyone who listens to know that you're not alone. Somewhere there is somebody who can relate to you. There are people that want to hear from you. Myself, there are other providers. Find someone to talk to, even if it's somebody on a park bench, another parent. The biggest lie is that you are alone.
And to add to that, I would say too, another lie I think I felt when I was in some of my darkest times was that this will be forever, that I will never be okay. And again, there is help. There are ways. Nothing is forever. Tomorrow you might wake up and feel completely differently. So thank you. I appreciate that. I love that. I love that word. And thank you for being on. It was great.
Thank you for having me, Priscilla. It's such a joy to see you again.
You too. Well, thank you. Thank you. And we will talk again soon. All right. That's our episode for today. This is a hard topic, but a much needed topic. We don't talk about this enough, how important this conversation is, that we need to talk about child abuse, that it is an epidemic and that we can prevent it. This shows what happens later in life if we don't take this seriously. This is always a great reminder of ways our community can come around children and parents, and we can protect each other. So I hope you enjoyed today's conversation. We would love to hear from you if you have questions or comments. We are going to be diving into this topic even deeper in the coming weeks. In April, it is Child Abuse Prevention Month, and I'm going to have the immense honor to sit down with our executive director, Amanda Sarisian. So please check that out. And as always, we always love to hear from you. Please subscribe to our podcast on Apple, Spotify, or YouTube. And until then, stand strong, stay safe. I will see you next time.